Occupational English Test. Listening Test. This test has 3 parts. In each part, you'll hear a number of different extracts. You'll have time to read the questions before you hear each extract, and you'll hear each extract once only. Complete your answers as you listen. At the end of the test, you'll have 2 minutes to check your answers. Part B. In this part of the test, you'll hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare setting. For questions 25 to 30, choose the answer A, B, or C, which fits best according to what you hear. You'll have time to read each question before you listen. Complete your answers as you listen. Now look at question 25. Questions 25. You hear a doctor talking to a pharmacist about adjusting medication for a patient. Now read the question.
We need to adjust the antibiotic dosage for this patient because the infection hasn't improved.
I'll review the medication record and suggest the appropriate dosage.
Thank you. We need to ensure the patient receives the medication this afternoon.
Questions 26. You hear a nurse talking to a technician about monitoring a patient's blood pressure. Now read the question.
The post-surgery patient needs to have their blood pressure monitored every hour.
I'll set up continuous blood pressure monitoring at the bedside.
Good. Remember to check the equipment before use.
Questions 27. You hear a pharmacist discussing with a doctor about a patient's medication allergy. Now read the question.
This patient has a history of penicillin allergy. We should choose an alternative antibiotic.
That's correct. We'll use ceftriaxone instead.
I'll update the prescription and notify the nurse.
Questions 28. You hear a doctor asking a technician for blood test results. Now read the question.
I need this patient's blood test results as soon as possible.
I'll prioritize processing the sample and send the results within 2 hours.
Thank you. This is crucial for our treatment decision.
Questions 29. You hear a nurse talking to a doctor about a patient's post-surgery pain management. Now read the question.
The patient is complaining of post-surgery pain. I checked and found the pain medication hasn't been administered.
Please give the patient morphine immediately.
Okay, I'll do that and monitor the patient's response.
Questions 30. You hear a technician talking to a doctor about the availability of an MRI machine. Now read the question.
The MRI machine has just been serviced. It's ready for use.
Great. We'll schedule the patient for an MRI scan this afternoon.
I'll prepare the machine and make sure everything is ready.
That is the end of Part B.
AVN Pharma Education.